Well, it's certainly hard to get your hands around what the Institute does because there's so many different things. People know us in some cases because of our role with the St. Louis County Department of Health. Our physicians provide all the services at the 3 health centers run by the St. Louis County Department of Health, and also provide medical services to corrections medicine of the St. Louis County Department of Health, 9 school districts, several social service organizations, the Housing Authority, the community clinics. There's a real common thread there, and the common thread is that we're taking our services closer to where people are, making it easier for folks who have a lot of burdens outside of their health care that they're trying to deal with. And we're trying to make sure that we can bring health care to them so that poor health isn't one of the things that weighs them down.
I'm partial, of course, to looking at those vulnerable populations that generally don't get the resources that those who are more well off do. And those vulnerable populations certainly include school kids. I think that one of the greatest things that the Institute does is its involvement in young people.
I would describe Institute for Family Medicine as compassionate, very mission-driven. They provide the links that, for so many of us who are trying to improve public health, that we ordinarily wouldn't have.
We need to create new models of delivering health care and new ways of approaching problems that have existed as long as we've had societies.
People talk about the need to have a net to catch those who fall through the regular system of health insurance and health care. And the Institute for Family Medicine, it seems to me, is one of those organizations that is designed to try to do what the healthcare safety net really doesn't do very well. That net has got too many holes in it.
And there are still people falling through those holes. And whether that's because of economics, or whether it's because of transportation, or whether it's because of education, what we're trying to do is patch those holes. And we're trying to catch those folks as they fall through.
The Institute has been just a godsend to us because many of our children have been very mobile through the foster care system, and many of them have come without their basic medical needs being met, and also frequently no preventative care at all. And so the Institute has played a vital role in helping us bridge that gap in really getting the children early and helping them with those medical and preventative issues that they need to have addressed.
I think the Institute for Family Medicine has the role of extension and connection in the community. They go the next step above and beyond what some of the other agencies are able to provide. They're looking not only to provide the care, but to develop that trust with people, other providers, and also with the individual patient and their families.
I see the role for the Institute as trying to find creative ways to address problems that either are typically not addressed in what have become traditional models of healthcare delivery in the area, or for innovative ways of approaching problems that maybe other organizations have given up on.
I would describe the Institute of Family Medicine as an agency that understands the importance of bringing the services to the client. Actually bringing the services into the school building as opposed to trying to get the clients to come to them really allows us to better serve the clients and get more immediate results. I've heard more from, obviously, the nurses, since I work and interact with them more, but also from principals, that they are noticing decrease in the absenteeism rate because we are able to keep children in school and keep them healthier while they're at school.
In the city of St. Louis, there are various resources, so you may be thinking, why is it important to be in the building of public housing, which is where the clinic is based? And my answer to that would be these patients have a lot of barriers financially, as well as education-wise. The patients appreciate us coming here. We do make home visits. I'll go up to the apartment and check out glucose or blood pressure.
I have been working with Vietnamese elders who have chronic disease, and we have been trying to find a family doctors for these elders. What impressed me most is the providers care for the patient here. They are willing to go the extra mile, and they always with the patient with big smile. That help a lot. That cut down a lot of barriers between the provider and the patient who have different language. This is more than a clinic. This is a family where the provider are willing to go 2 or 3 extra miles to help the clients, and I have first-hand experience with that.
We are the envy of my colleagues as far as how we compare with other children's homes in our medical care, because the Institute staff comes on campus for us, and that does a couple things for us. Number one, it's a very efficient way for us to deliver those healthcare services to our kids. And secondly, for our kids who deal with a lot of anxieties and fears, the medical staff is providing a comfort zone for them because they're on their turf and familiar surroundings. So it's a holistic approach to helping our kids in their medical care.
One of the major initiatives of the past year and a half has been our reaching out to a small neighborhood clinic that catered to immigrants and refugees called La Clinica. And La Clinica needed some leadership.
Esta clínica trata muy bien y pues nos trajo una amiga aquí porque ella ya otras ocasiones ha venido aquí y le gusta el trato.
Trata a la gente muy bien y mucha ayuda para todos.
I'm most proud of the fact that we've created a new model for healthcare delivery, particularly among the underserved in St. Louis. The way we've managed to deliver care has complemented and kind of filled in the gaps that existing systems in St. Louis was not able to provide.
They put their mission above profits. They do what they need to do. They serve a population that so many have forgotten or ignored.
It is supported by some very, very dedicated people. The staff, exceptionally dedicated to what they're doing. The Institute for Family Medicine gets at kids, gets at families. It tries to reach people before they get to the point where they really need to receive acute care. I think that role of education, prevention, wellness, reaching out to the vulnerable folks in this community is a tremendous service.
Well, I hope that people would just see that the Institute's trying really hard to do an important service in a unique and creative and economical way. And that we're good partners, that we're not trying to recreate the wheel, that it's not about us, that it's not about the individuals, it's about the people we serve, and that from that perspective of being a good approach to this problem, that people would want to be part of that.